Are you a nursing student struggling to stay focused in class? Do lectures feel overwhelming and hard to follow? Don't worry, we've got you covered. This channel breaks everything down into simple, easy to understand lessons so you can study smarter, not harder. Welcome to the Nursing School Survival Guide. Let's get started. Want to know the secret behind every nursing exam? It's not memorization, it's something way simpler. You just need to understand this one thing. If you're a nursing student, you've probably heard of the nursing process. But do you really get it? Or does it feel like one of those things you memorize and hope you'll understand later? Well, today I'm breaking it down for you. We're diving into the 5 key steps of the nursing process: assessment, diagnosis, planning, implementation, and evaluation, and why getting this right will make you unstoppable. Here's the issue. So many nursing students struggle with connecting these steps in a way that actually makes sense.
I don't even know what that means.
It's easy to get lost in the jargon or feel overwhelmed by all the details. But what if I told you there's a simple way to remember each step and apply them like a pro? That's exactly what we're doing today. Let's start with the first step: assessment. It's not just about asking what's wrong, it's about getting a clear picture of the whole situation. You're gathering data from all kinds of sources: the patient, their history, physical exams, even lab results. This is where you start building your nursing foundation. If you don't do this step thoroughly, you're setting yourself up for mistakes down the road. Now, once you've gathered your information, it's time for diagnosis. This is where you pinpoint the patient's actual health problem. And no, it's not the same as a medical diagnosis. As nurses, we focus on what's happening in relation to the patient's response. Think of it like figuring out the reason behind their symptoms. Without a clear diagnosis, how can you plan effective care? Next is planning. This is where you create your game plan. You're setting clear, achievable goals for your patient's recovery. What needs to happen to improve their health? This isn't just about wishful thinking. Your goals have to be specific, measurable, and realistic. Then we move to implementation. This is where the action happens. You put your plan into motion. You may administer medication, teach the patient new techniques, or provide hands-on care. This is where you show what you're made of. Finally, we get to evaluation. This is where you check if your plan worked. Are the goals being met? Is the patient improving? If not, it's time to reassess and adjust the plan. You've got to stay flexible and make sure you're doing what's best for the patient. Here's the thing that many nursing students miss. The nursing process is cyclical. That means it's not just a straight line from assessment to evaluation. You're constantly looping back. You might assess again, adjust your diagnosis, or change the plan. It's an ongoing process that gets better with each cycle. Once you understand that, it all clicks. So, whether you're studying for exams or working with patients, mastering the nursing process is key. Start by understanding the flow, how each step builds on the last. With a solid grasp of these 5 steps, you'll feel more confident and prepared for anything in nursing school. Want more tips to ace nursing school? Hit that subscribe button and let's get you through it.